Welcome to Fayette Regional Health Talk. I'm Doug Fischesser.
And I'm Charity Moore. Thanks for joining us. For those of you joining us for the first time, Health Talk is made possible by TV3 and Fayette Regional Health System. This is a chance for viewers in the Whitewater Valley to get a closer look each month at specific health and wellness topics that affect each of us every day.
And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk is the announcement by Fayette Regional Health System that they are still offering free and reduced mammograms for qualifying participants through the 2013 grant awarded to us by the Indiana Breast Cancer Awareness Trust.
That's right, Doug. This program is funded through mammograms for uninsured and uninsured women in Fayette, Franklin, Rush, and Union counties. Fayette Regional recognizes the increasing need for community members to have access to educational information and preventative screenings related to breast cancer. This grant makes both of those possible. Fayette Regional will offer free digital mammography screenings to women who are over the age of 35 living within our 4-county service area with no medical insurance and no access to this service. Fayette Regional also provides supporting educational information about mammography and early detection methods. In addition, Fayette Regional continues to participate in several cancer awareness events in October throughout the year. These events raise awareness and funds that stay right here in our area. During the month of October, Fayette Regional will offer mammograms for just $125 as part of its continuing efforts to make this important screening available to everyone. To learn more about the Fayette Regional Mammogram Program, call 765-827-7703.
In other news, the Office of Healthy Women OBGYN has a new location. Dr. John Landry and Dr. Amy Wynn and their staff are now located at 3542 Western Avenue in Connersville, just next to the HealthWorks Fitness. The doctors and staff are excited to offer this newly renovated facility to their patients. Call 825-0538 for more information.
And as always, Fayette Regional is proud to sponsor and take part in several upcoming events. First, we have 2 breast cancer awareness fundraising events. The first one is the Fayette County Cancer Society's Pretty in Pink Pajama Party, which is this Saturday, October the 12th, from 6 to 10 p.m. at the Miller Building in Roberts Park. This will be a fun evening filled with food, fun, facials, and much more. Franklin County will also host its own Pink Pajama Party, which will be next Saturday, October 19th, from 7 to 11 p.m. at the Schilling Center in Brookville.
The public is invited to a reception to meet Dr. John Landry, Dr. Amy Wynn, and the staff at Healthy Women OBGYN. The reception is Wednesday, October 16th from noon to 1 p.m. in the Fayette Regional Hospital atrium. October 29th, 1 p.m. to 7 p.m., Fayette Regional and Dr. Burke Chager will host a cosmetic enhancement seminar with refreshments and special promotions available. Call to reserve your seat.
In Fayette Regional, Home Health and Hospice Annual Memorial Service will be held Thursday, November 7th at 7 p.m. at the Growing Branches Christ Church. All are welcome. Please be sure to RSVP. And finally, Fayette Regional is hosting 2 more special events. The first is a reception honoring the opening of the new Jerry Sykes Services Wing at the Fayette Regional Care Pavilion and will be held on Thursday, October 17th from 4 to 6 p.m. The Fayette Regional Jerry Sykes Services Unit is the area's most up-to-date senior behavioral health facility. The public is invited to attend this ribbon-cutting ceremony and reception. The second is Fayette Regional's annual health fair that will be held Saturday, November 2nd from 8 a.m. until 12 p.m. in the Miller Building at Roberts Park with free health screens and more. But we'll talk about that later in the show.
When we return, our guest will be in the studio to tell us a bit more about the new Jerry Sykes services at the Fayette Regional Care Pavilion.
Fayette Regional is proud to welcome Dr. Amy Wynn to our Healthy Women OBGYN staff of physicians. Joining Dr. John Landry, Amy will be providing outstanding OBGYN services to the women of Fayette County and the Whitewater Valley. Visit their offices at 1908 Park Road or give them a call at 825-0538 to set up an appointment. Great care is right here at Fayette Regional.
Welcome back. Earlier this month, the Jerry Psych Services Wing at Fayette Regional Care Pavilion opened. Joining us today are Tammy Dowd, Business Development Director, and Jessica Couch, Nurse Manager from the Jerry Psych Service Unit. Welcome to Health Talk, ladies.
Thank you.
Tammy, you were with us last month and you had announced that the opening of these services. Can you tell us a little bit more about that and how's that going?
I would love to. The facility is amazing. We are so pleased with the way the building has turned out. Fayette Regional broke ground in spring of this year, and it's a nearly 8,000 square foot facility.
Oh, wow.
It has 12 private rooms and a large dining room, a spacious quiet room for private counseling, a large patio, and our patients really enjoy going out to the patio area. Plus, the new addition, it incorporates several high energy efficient systems and a state-of-the-art security system.
Oh, wow, that sounds really impressive.
It's wonderful.
What was one of the reasons behind developing this type of a unit here in Connersville?
Mm-hmm. According to the National Institute on Aging, today there are more than 6 million Americans 85 years and older. And that number is expected to more than triple by the year 2050. In addition, mental illness affects 1 out of every 5 American adults. And Fayette Regional saw the need and decided to answer the call to our aging population.
Oh, okay. Well, what are some of the features that we have at the new Jerry Psych unit?
The senior care unit is a medically managed inpatient unit providing 24-hour intensive coordinated therapeutic care to our seniors in crisis that may be needing behavioral stabilization. And along with meeting the needs of our senior community, Fayette Regional is proud to have created and maintained jobs throughout this entire process. From the 23 new staff positions at the hospital, the contracted workers, all have taken part in this development. It's had a huge impact in our community. We're also very pleased that we're able to save local families time and money by eliminating the travel to other facilities.
That's a really awesome thing there. Who are the patients that are treated at the new Jerry Psych unit, Jessica?
Well, at the new unit, we are treating seniors who may be dealing with a whole gamut of issues, physical, social, emotional, and or mental issues that are related to aging. This includes those suffering from something as common as depression, but even as complicated as dementia with significant behavioral changes.
Okay. Tammy, you had mentioned the number of staff that was hired for this new unit. Jessica, can you tell us a little bit more about them?
Absolutely. We are very blessed to have Dr. Osman, who is out of Indianapolis. He is our medical director and board-certified psychiatrist with extensive geriatric experience. He brings along to the team a team of nurse practitioners who are also highly skilled in the geriatrics, an activity therapist who provides therapy on the unit, music therapy, art therapy. She's phenomenal. Also other trained teams of professionals. We do staff with highly skilled registered nurses that have various backgrounds from medical surg nursing to ICU, emergency room nursing. With that as well, psychiatric nursing. We know how to safely treat those seniors and effectively prescribe the medications for them. We use an interdisciplinary team approach that ensures that all aspects of the patient's needs are met.
Can you tell us a little bit more about that interdisciplinary team and explain like who and what is involved in that?
Absolutely. In healthcare, the Center for Medicare and Medicaid Services, they regulate many things and they dictate, but they are dictating that each patient must have an individual comprehensive treatment plan that must be based on a patient's inventory of strengths and disabilities. This plan has got multiple components. It includes a substantiated psychiatric diagnosis, short-term goals, long-term goals, the specific treatment modalities that will be used on the unit, the responsibilities of each member of the treatment team, and adequate documentation to justify the diagnosis and the treatment and rehabilitation services to be carried out. This is done by the interdisciplinary team, which does consist of the psychiatrist, program director, the registered nurse, social worker, and the activity therapist. This team usually meets twice a week, but the level of care that we give, it's paramount that if we need to meet more, we will.
That's good.
Okay. Well, what are some of the goals for the team?
Personally and professionally, we want to provide an environment that enhances communication. You know, in healthcare, when they are going from one unit to the next, pieces of information is missing at times. And if we have the full puzzle and we start that at the admission process and enhance that communication, it will really impact that care that's being provided, and when they're discharged, they'll be able to return to that level that the family member wants them to return to or hopes that they return to. We want to offer mutual support while enhancing the roles of each discipline and encourage education and training. I can't stress that enough with the staff. We want to be up to date, do our continuing education, keep current on medications and modalities that can be used. We want to assess and stabilize the presenting symptoms.
Okay. How does the team goals affect the patient?
Our team goals, I believe they go hand in hand, directly there. If we want to be successful as a team and our program to be successful, we want to help our patients develop new skills to improve their coping mechanisms. Now, we may get a patient and it may be undetermined of why they need extensive services or they need inpatient behavioral health. So we start at the beginning, we assess them, carefully assess them. When they first come in, not only are we looking at paper, but we're looking at the whole person. We're looking from top to bottom. So we're assessing, helping them improve those coping mechanisms. They may need help to develop those. Perhaps I may remind them of someone that maybe they had an encounter with long ago, and that may trigger something. Perhaps I remind them of someone that they are remembering, and that will help in the treatment process as well. We want to improve their daily functioning and integrate psychoeducation for the entire family as well. If we, our patients, we're providing the education for them, if we don't do that extra step, that extra essential step, then we're doing a disservice there as well. So we want to incorporate the entire family or those that are involved in the whole planning process. Developing that plan for support and aftercare resources is just we need to get that started as soon as we can.
Oh, wow. Okay. Well, we will be right back to discuss the qualifications for admissions right after this.
Fayette Regional is your community hospital, serving the local area for 100 years. Founded in 1913, Fayette Regional has been providing great health care to the Whitewater Valley for a century and giving back to the community with outreach, support, and donations, as well as employing over 600 people in the local area. Fayette Regional, your community hospital.
Okay, we're back. Jessica, how does a patient qualify for admission?
To be admitted to the Geri Psych unit at Fayette Regional, they must have a psychiatric diagnosis. This also could include suicidal or homicidal ideation, imminent risk for danger to self or others, other psychiatric symptoms severe enough that can cause disordered, bizarre behaviors, or serious deterioration of a person's baseline. The inability to fulfill age-appropriate responsibilities is what the criteria would be.
Okay. Once a patient qualifies for admission, what kind of process is that?
It may seem like a lot at first, but we do it in an easy manner. Someone such as the spouse, the other facility, a different caregiver, they can call our unit. We'll ask them information, and I know sometimes if a family member calls in, they may not want to give out information.
Right.
They may not want to, for confidentiality reasons, or mental health in itself has such a stigma. and they're reaching out. They need help. So we don't try to pry too much, but it is essential that we do get components answered when we do ask. We ask demographic information about advanced directives, the legal status, brief description of the patient's symptoms or presenting behavioral issues, their current medical status, any medications that they're on. We may ask if they've had any previous psychiatric treatment, and at times they are reluctant to let us know that. There's a misconception if they've been in other facilities or they've been someplace else that will mark them, or that they wouldn't be able to gain access to health care that way. If the call is coming from a facility, we'll ask them to fax some nursing notes with behaviors that's been documented within the last 48 hours. We'll ask them for any types of medications that's been administered. Laboratory results such as a complete blood count, metabolic profile, and a urinalysis. We'll ask about any advanced directives. If they've had a psychosocial or psychiatric assessment, we will ask for those records. History of any previous psychiatric evaluations, any additional information pertinent to admission so that we can start from the beginning to try to help. Once we get that information, we relay that to the psychiatrist to make sure that the patient is appropriate. Our promise, because sometimes that call comes in, they're just waiting to try to get help. So our promise is 1 hour from the time of that call to get them an answer.
That's great.
If a patient is coming from another facility, and they're medically stable, we'll consider them a direct admit to the unit. For safety purposes, if they are coming from home, though, we do request that they go to the emergency room to get that medical clearance. Many times in the aging population, if there is something going on, such as maybe something as simple as a urinary tract infection, that can create some psychosis in the aging population.
Really?
Or if there's been some mixed medications and so forth. So we want to get that medical clearance just so that we know, because this is a behavioral health unit. Though we do have the 24-hour medical coverage, and we're taking care of those medical needs as well, we want to make sure that they are placed in the proper facility at that time.
Wow, I never even thought that, a medical condition can maybe offset a behavioral condition. So that's interesting. What is the average length of stay at the unit?
7 to 10 days is the average length of stay. However, that can differ from diagnosis and the reason for admission. So that's just a little timeline there.
Okay. What's a typical day like on the unit?
We have a highly intensive structured program. On our unit, we have a large board. We've already got it laid out as far as from the time they get up till the time they go to bed at night. Does it always get followed like that directly? No, because we do have the multidisciplinary team approach, and we also have individualized treatment planning. Therapeutic environment, we will always strive to provide that. We want to make sure that they're safe, that their basic needs are met, and then we go above and beyond to make sure that we are doing what they need at that time. Age-appropriate group therapy. If we had someone that was, for instance, 70 years old, we wouldn't want to put them in therapy for the group, someone that's 95. They're on two different levels there. It can happen, and it does. The group therapy, though, it could be something as simple as playing bingo, really. Playing bingo or spirituality groups, or they may get out books and they talk about where they've traveled to, where they've been, those types of things. Individual and family therapy. We want that family involvement, so on a weekly basis we're going to be doing family support groups for them to come in if that's a need. Individual therapy, they'll meet. We do have a therapist that does come and do intensive therapy with them. The level of therapy would depend upon what their diagnosis is. Family patient education, we want to keep them abreast of everything that's going on while their loved one is in our care. Individualized treatment planning, like I had mentioned earlier. Yes, they may come in with a diagnosis of depression. Well, where did that depression come from? What is it stemming from? What's went on, the life events, and not one thing works all the time for one person. So sometimes it takes a little bit of time, and that's why we do that planning, so that we can. It's listing out things that are working for that one. Cognitive therapy, when we're building upon their strengths as far as their level of cognitive functioning. If we do get those that have dementia or Alzheimer's, their level at times is affected by that disease process. Validation. We never want to be in groups with a resident and tell them that they're not seeing things or they're not, we want to validate their feelings. We want to express and have empathy with them. Reminiscence therapy could be, get out photos of it when they was in the war, or their kids when they were born, and share scrapbooking, or perhaps there is songs that they bring them back to a time in their life. Music therapy. Our activity therapist is wonderful. She'll come in, she plays guitar, the bongo drums,
cool.
they do singing. They have a time with music therapy. Activities of daily living, we're helping them take care of their basic needs, and it's wonderful. Sometimes just their hands need to stay busy. So, okay, here's 20 washcloths you can fold, and they feel that sense of accomplishment while they're in there at times. And then extensive discharge planning and coordination. When they come to our facility to get help, we want to make sure that when they walk out that door, or they're taken back to the facility that they came from or back home, that we have a plan in place to make it successful upon their discharge.
Well, that kind of goes into my next question, is what happens when they are discharged? So
the discharge planning process actually starts at admission. Sometimes it takes a little bit of time to get some services in place. Our social worker is on the unit, is meeting daily with the patients. Whether or not they're from an extended care facility, an assisted living facility, or home, whatever the case may be, we want to make sure that we can get home health. If we need physical therapy, occupational therapy in there, we want to put those services in place. Perhaps they just need someone to take them from appointments back and forth. But that social worker is the connection piece there with that discharge process, so that they are successful when they do leave the facility.
wow, that's really amazing. A lot of interesting stuff that you guys are doing over there. To sum it up, what are some of the things that is unique to our unit over there?
What I think is unique is a lot of behavioral health units these days are grouping adults, geriatrics, they're grouping them all together. And that does not really provide a very good means of a therapeutic environment. So, if your 85-year-old grandma is admitted to our unit, you can rest assured that there's not going to be that 35-year-old burly psychotic man in there that could harm or scare your grandma.
Well, that's definitely good to know. Since you did touch on that separation there, can you tell us more about the child and adolescent side of the care pavilion? Can you talk about
Absolutely.
that?
The geriatric side, we just got that open, up and running, but right there also is a little gym all in itself. We do have a 30-bed children and adolescent unit. We service ages 6 to 18 years of age with a multiple passel of psychiatric diagnoses that they could have. They have to, for admission, be a danger to themselves or others within the last 24 to 48 hours. We see anything from depression, bipolar, attention deficit, hyperactivity disorder. Maybe they've had some issues at school. We see, as of late, some of the self-harming with cutting, some that have tried to overdose. So there's a whole gamut there with that. Our acute unit is the 8-bed unit, and typically they're there anywhere from 3 to 5 days. We stabilize them, get them set up on outpatient therapy if they're not already in the therapy system. Maybe start medication, or sometimes adjust medications as well. As a nursing professional, I don't always feel that a pill is the answer to everything. I feel that you have to look at the whole system there in place and make decisions without just giving someone a pill. Referral sources, the Fayette County School Corporation does a lot of referrals for us. Department of Children's Services. We get children in from adoptive families, foster families, or just homes, just regular homes that's having some difficulties. And then our residential side is a more long-term placement. Average length of stay is 6 months. And they work on short-term, long-term goals. And from there, we put them back into their homes or reunify them. And most of the time, they're followed back through with outpatient therapy. We do have a full-scale outpatient services as well there at the Care Pavilion. Right there on that corner of Erie Avenue, and there's just so much help right there in that building, whether or not it's your 6-year-old child or it's your 85-year-old grandmother. So those services are there, and until someone needs those services, they're overlooked quite a bit. And with mental health, it carries that stigma, but we're there to help. And I'm just so glad that Fayette Regional has seen this need to enhance these behavioral, and on that unit as well is Dr. Osman. He's the medical director as well. So we have that connection as far as that continuity of care from different age groups too.
Go ahead.
I had a question. Now, I understand there's an adult outpatient on the other side. Is that correct?
There is adult outpatient.
Okay. And then the child and adolescent, are those only admitted from Fayette County, or do you extend into other communities as well?
No, it's other communities. We have all throughout the state of Indiana.
Okay.
Our intake process for that is much the same. You call into the Fayette Regional Care Pavilion, and there are some questions, not quite as extensive as for the geriatric side, but then the determination is made of whether or not they meet criteria for admission.
Okay.
Well, bringing up the point that you do have the child and adolescents, perhaps the middle-aged adult, and then your seniors. Is this an open facility? Do they all intermingle, or are they isolated, separated?
No, each unit is distinct in itself. They may be housed in one building, the Fayette Regional Care Pavilion. However, on one side is the children and adolescents, and the other side is the geriatrics. They are both in locked, secured areas.
Okay.
So there's no intermingling or anything of that nature. And then right in the center of that is the outpatient services that come and go.
Oh, okay.
So safety is ensured, and then separate programming is on each unit.
Okay. Well, I'm sure that really gives the families a lot of peace of mind, knowing that they are in a safe, caring environment. Thanks so much for joining us today. What an interesting story that you guys have to share with the Geri Psych services over there.
Thanks for having us.
Fayette Regional is your community hospital, serving the local area for 100 years. Founded in 1913, Fayette Regional has been providing great health care to the Whitewater Valley for a century and giving back to the community with outreach, support, and donations, as well as employing over 600 people in the local area. Fayette Regional, your community hospital.
Welcome back. Charity, you mentioned earlier that Fayette Regional is hosting a health fair on November 2nd. Can you tell us more about that?
Sure. We are hosting our annual free health fair on Saturday, November the 2nd, from 8 a.m. until 12 p.m. in the Miller Building at Roberts Park. And a number of our local agencies are going to be on hand this year, including the Eye Center of Connersville, the Fayette County Public Library, Fayette County Cancer Society, and today I got the phone call from the school corporation. They'll be joining us as well.
Good.
And lots more. And everyone's just going to get together and help educate our community in the areas of health and safety, and providing a variety of free screenings. And some of those screenings that we're going to have are cholesterol, our blood sugar, blood pressure, some bone density, and a lot more. There's going to be lots of door prizes and giveaways at every booth. And last year, Sparky the dog from the Connersville Fire Department was on hand to interact with the kids. So I'm really hoping that he'll be there again this year. And so it should be really good.
Sounds like this is going to be a family-oriented event.
Absolutely. Kids, parents, grandparents, just everyone in the community is encouraged to come out and enjoy this free health fair.
Great, sounds great. If your organization would like to participate in the free health fair, please contact Charity by calling 765-827-8058 or emailing her at charitym@fayetteregional.org. That's all the time we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Doug Fischesser.
And I'm Charity Moore.
Stay healthy, Connersville. And if you're not, stop by and see us.